This is the Padua Podcast Network.
I should have been born 100 years ago when there were nowhere near as many people. Running a Fever, episode 182, testosterone facts for men and women. Really feeling it now, really just looking forward to getting in the car and drinking that bottle of water and getting home and resting. So, first question, why women and men? You may not know this, I didn't know for a long time, but women have testosterone and men have estrogen. Yes, it's true. It's produced by the sex glands, testes in men and ovaries in women. Men have 7 to 8 times more testosterone than women and produce 20 times more on a daily basis. So no surprise that men have more testosterone than women, but both sexes have testosterone. Going through the woods now, not as much wind and far enough away from the parking lot that there's not as many people. I should have been born 100 years ago when there were nowhere near as many people. So what is testosterone? It's a hormone. Hormones are chemicals that control bodily functions. So in the past we've discussed a lot of other hormones like the brain chemicals in episode 139 and 150 to 154. Went into detail on several of those. We also mentioned ghrelin and leptin, which are hormones that control appetite and fat conversion. This one controls some secondary sex characteristics. Howdy. Testosterone is also considered a special type of anabolic steroid called an androgen. Steroids affect cell membranes and send signals like other hormones. Androgens are of the particular kind of steroid that regulates male characteristics. Hey, why is testosterone so important? Why am I even talking about it here? I mean, I always thought men have it, women don't. That's what it's supposed to be. And nothing I can do about it. Nothing I need to do. But I said that in ignorance, and in recent months I've learned more about it. Testosterone affects the growth of muscle mass and strength. These are generally desirable, so we need to make sure that we have a healthy amount of testosterone. In men, production decreases with age, and it can be prescribed for low testosterone and has other applications as a drug as well. Women can be prescribed testosterone as a treatment for breast cancer. And it's also one of those steroids, even though it is naturally produced, that athletes use, often illegally and against the rules of sport, in order to improve their performance. Studies have shown testosterone levels do not affect the risk of prostate cancer, but that drastic reduction can increase the rate of spread of the disease once contracted. In women, high levels have been associated with menstrual cycle irregularities. So you can, how do you even know, right? You can get your testosterone level with a blood test, though you'll probably need to ask for it specifically and may need to pay extra for it. Standard test you get as part of a physical may not include that, so just check with your doctor when you get your physical. I did get a testosterone test with my last physical and found out that I don't think there was anything dangerous about it. It might have been a little different than normal, but I don't think there was anything. I don't think it was terribly out of range or anything. Or I would have heard about it. So what you're gonna get, when I got this, I got a level, and it's expressed in nanograms per deciliter. The normal range for men is 270 to 1,000 70 nanograms per deciliter. So that's a pretty wide range. Research shows the healthiest men have levels in the 400 to 600 range. A higher than normal range can be beneficial with regards to blood pressure and risk of obesity and heart attacks, but there are drawbacks, which include a tendency to consume more alcoholic beverages, to smoke, to get injured, and engage in risky behavior, which is physically dangerous or criminal. So it's really something you just kind of want to be in the range of. You probably don't want to be taking it unless you're deficient. Could be dangerous. A little quieter here, but there's still a lot of people out today. Still summertime, although I think school has started. It's overcast. Still. I almost brought my headlamp out here because I thought it might be dark. Even though I was coming out, it wasn't even 5 o'clock when I got out here. So probably not, I'm probably fine not having it, but with it being an overcast, it sometimes can get dark enough to need it. Later in the day, I think I'm gonna make it. Still feeling the pain, but I guess I'm over the threshold that endorphins are overpowering it enough I can get through. So I'm going to go ahead and give you a little controversial editorial comment here. Testosterone is regulated and it can be harmful, so perhaps it should be regulated. There is a perceived abuse of the drugs in athletes. However, it can be legally used with a prescription. One application is in hormone therapy used for patients with gender dysphoria. Now, this is a psychological disorder, and hormone therapy does not affect the psychology, not directly. It works to change the physical characteristics to match the perception caused by the disorder. If this is the case, it is effectively used for an elective aesthetic purpose. So if that's the case, why can't males be prescribed the drug to improve their appearance and strength? Something to think about. I'd love to know your views on the matter. I'd really upset you here by just bringing this up. I'd still like to hear from you. mail@runninginfever.com if you want to email me. Personally, I would discourage anyone from taking testosterone except to correct a lower than normal level, a deficiency. So don't take it, whether you have a prescription or not. Testosterone and other hormones are produced while we sleep. And this is another reason why sleep is so important. And the highest levels of testosterone in a day occur during REM sleep. Interrupted REM cycles can cause, that's rapid eye movement cycles in your sleep, can cause low testosterone, and there is a positive correlation between sexual dysfunction and sleep apnea causing disrupted or less sleep. This is true of both women and men. So, you definitely want to check out episode 179, in which I talk about some of the big reasons you need to get the right amount of sleep. So there's a lot of references in here, including I referenced a bunch of different prior episodes. And as usual, I have links to all those in the show notes, which you can find at runningfever.com/182. Hope you enjoyed this episode about testosterone. Really informative. I enjoyed learning about it. And if you got the fever, keep it. If you don't have it, catch it. And I'll talk to you next time on Running Fever.